Hi there, I'm Dr. Shinjita Das. I'm a Harvard dermatology resident, and I wanted to welcome you to my new show, Derm Talk. I'll be your host every month and hopefully bring in some guests to teach you guys about skin diseases and how they affect you. So basically, the show is about skin for people with skin, which basically means everybody. I hope that you enjoy this show, and I wanted to welcome you guys. So this morning I have with me Dr. Steven Chen. He's one of my co-residents and friends, and he's gonna talk to us a little bit about eczema and dry skin care. Dr. Chen, can you tell us a little bit about yourself?
Sure. So just like Shinjita said, I'm also a Harvard resident in dermatology. I guess the little difference between Shinjita and myself is that I'm also an internal medicine resident at Beth Israel. So I get to see patients both in and out of the hospital for both internal medicine complaints and for skin issues. And it's a really fun way for me to interact with both fields as well as to see diseases from both fields and how they interact with each other. Excited to be here, and I hope we can help bring some more knowledge about eczema and dry skin and just the skin in general to everyone.
Right. Well, it's so great to have you on board. Today's episode, we're going to focus on three things. For most of you, this is probably the first time that you're learning about skin in a more formal sort of setting. And we want to start out discussing the structure and function of the skin, just a brief overview for you guys. And then we'll dive into what eczema and dry skin are about. And finally, what you can do for yourself at home as well as in the clinic to help your dry skin this time of year. So I've got some little note cards with me, and since this is the first episode, I haven't had a chance to get questions from you guys. So what I did is I surveyed my roommate, my neighbors, and friends to get a list of questions that they'd be interested in. So hopefully we can answer this for you guys. So one of the biggest questions that came up was, why skin? Why a show entirely about skin? Well, it's the largest organ, right? And it's very visible. It's something that people see. And as Steve will get into a little bit more, it does allow a window into what's going on internally. So I want to show you guys a first slide that shows a diagram of the skin. And we can go over the different layers of the skin just to give you a little overview. So Steve, what layers are we looking at right here?
So on the slide you can see that there's really three main layers to the skin. There's the epidermis, which is the topmost layer, the dermis, which is in the middle, and then the subcutaneous layer, which is really just fat cells. And what we're going to focus on today in terms of eczema is really talking about the changes that really happen in the top and kind of the middle layer, not so much the bottom fat layer. What you'll also notice is that you can see hair follicles, and you can see there's blood vessels that course through the skin, and of course sweat glands. And that's all very intuitive since we all are very familiar with our own hair follicles and sweat glands as well. But we'll talk about how eczema affects these things and what we can do to help treat it so that we feel better, especially in the wintertime.
Great. So in terms of the function of the skin, you guys had a chance to take a quick look at what the skin looks like at the cellular level on the diagram. So what are some of the functions of the skin? Why is it so important for us as humans?
Well, I think the easiest thing that we can think about with the skin is really that it's a barrier. It really protects us from our environment, and it's not just protecting us from germs and bacteria and viruses, but it's also protecting us from the temperature. It's protecting us from a lot of dangerous things that could be out there. So in that sense, it's really our first barrier and our first defense mechanism against the outside world. I think what else is really interesting about the skin is that it's a big immunologic organ. So what that means is really all the white blood cells that are going through our blood vessels, they also go to the skin too. So as dermatologists, we're very used to seeing how the skin reacts to those white blood cells, and we're used to seeing how looking at the skin can really tell us a lot about someone's immune system and can tell us a lot about what's going on underneath.
Exactly. So in addition to protecting our bodies internally from infection and from disease, the skin actually helps regulate our temperature. So it helps us through sweating. I'm sure all of you guys have experienced times when you're sweating, you're outdoors, whether you're nervous, whether you're exercising, helps regulate our body temperature. Also helps with sensation. So we have lots of nerve endings in the skin that help with that as well. Any other functions that the skin serves for us?
You know, I think the other thing, the big thing that you're mentioning is sensation. I think the big thing to think about is the skin is really how we perceive the environment. We use the skin to kind of sense what's around us. And obviously there's a lot of other, there's a lot of people that also would think about the skin in terms of its appearance. So that's also something that's important to some people and important to a lot of people. For us as dermatologists, I think we just really care about the health of the skin and how it interacts with the rest of the body.
Exactly. And so just to give you guys some fun facts about the skin. So in every inch of skin, there are over 19 million cells. That's a lot. In addition to that, when we look at the skin, there are the different layers. The topmost layer, which is the epidermis, actually consists of dead skin cells. And cells are continually renewing themselves on the skin. So in a given day, your body is shedding somewhere around 40,000 skin cells. And during that time, new cells are growing from the bottom to the top of the skin. And so our skin's very dynamic, it's growing throughout our lifetime, and it's very much alive and active. So now that we have a little bit of an overview of the structure and function of the skin, I'd like to hear a little bit about eczema. Especially this time of year, we have patients coming into the office complaining of dry, itchy skin, and it really wreaks havoc on their quality of life during the fall and winter. So what exactly is eczema?
Sure. So eczema is really, the way we think about it is that it's an auto-inflammatory condition. So complicated word, but what that really means is that your body is making your skin get inflamed. So that means that there's a lot of white blood cells that go to the skin. There's a lot of redness and itchiness is what you sense on the skin. And really what we've found out recently from a lot of research is that eczema can be caused by something that's genetic. It can be partially because of a gene that was maybe not exactly 100% right that was passed down from your parents. And so for that reason, your skin just can't hold on to moisture. If you have eczema, your skin can't hold on to moisture like you would say a normal person's skin might do. And then the other thing that's interesting about this is that we've also seen that people with eczema also have a decreased ability to fight off infections in the skin. So because of that, you're also more likely to carry these bacteria on the skin that can be ultimately harmful for your health. But the big thing that really bothers us is that inflammation. It's the irritation, the redness, the itchiness, the dryness, the flaking, and really it's all of those things combined that drive the eczema cycle.
And what is it about the fall and the winter that seems to make our skin get worse? For me, I have a little bit of eczema, and in the summer times I do great. But why in the winter time do we fall into pitfalls?
Well, I think there's a couple reasons. The first one is just that in the winter it's a lot easier to get dry, and I think a lot of that has to do with the weather. So it's colder, it's not as humid around, and certainly in Boston and in Chelsea, you know that it can be very, very humid in the summer, but you don't get that in the winter time, which is nice, but at the same time for the skin, it doesn't help keep the moisture in. The other thing is that we're using heaters at home, and so because of that, it dries us out even more. And then the other piece of it that I would really think about is what we do to ourselves. So because it's so cold, we take these really, really hot showers, and so that just makes us lose even more moisture. It's counterintuitive. It doesn't seem like it would make sense to shower longer, but really what that does is that it makes you sweat and it takes all the moisture out of the skin. And so because of that, it can actually worsen the eczema. And then the other thing is that we're using a lot of different lotions, a lot of different products, and sometimes for some people that can cause a different response. So we just have to be very careful about that too.
And I know I'm guilty right now. I'm wearing a wool sweater, and so items that are wool can irritate our skin, make us feel a little bit itchier as well.
Yeah, absolutely.
So now that we have an idea of these environmental factors, I think it tends to be pretty intuitive to people that wintertime is harsher on our skin, but we don't necessarily think about that. And so we've had a chance to talk about eczema. I oftentimes tell my patients that eczema is the itch that rashes. So what do we mean by that?
Well, so eczema, as dermatologists, we often talk about something called the itch cycle. So what that means is that for eczema, if you were to not scratch at your eczema, then that's probably the best thing you could do for it, because slowly it would go away. But every time you scratch, it just kind of makes it worse. So it's this whole cycle that when it itches, then you scratch at it, and it causes the rash to come up, which only makes it itchier. So you just keep on scratching. So it's one of those things where you get the itch first, and then because of your scratching, that's where your rash comes from.
And generally with eczema, what areas of the body do you see the eczema rash appear?
Well, that's interesting. It's different for adults and for little kids, like infants, really. And so usually when kids can start to reach their own skin and start to scratch, that's where you start to see it really appear on what we call the flexor surfaces. So what that means is that it's on the inner side of the elbow and also on the back side of the knees. Those are kind of the common places to see it. The other place that we often see it too is on the face. So we see a lot of eczema that's on the eyelids, and also on the hands. You can have a special kind of eczema that kind of looks like tapioca bubbles, like little bubbles that pop up too. And that kind of eczema can be very hard to treat. But those are the typical places I think of for adults. In kids, because they can't reach it, that's where you start to see it on the other side. Basically, it can be all over the place because they're not scratching, and it just kind of pops up. But often we see it on the opposite side. So on the outer side of the elbow, sometimes we'll see that, or just all over the body. It can be anywhere.
And something to keep in mind is that even though these are common locations, being in the flexural areas or on the face, oftentimes patients will present with eczema or dry skin everywhere, like Dr. Chen's saying, especially because if you're scratching, you're going to end up getting a rash in that sort of area. So what about those like red little bumps that people get on the backs of their arms, on their thighs, buttocks, and even on their cheeks?
So, Shin, that's a great question. I think that that's something that we get asked a lot about, and you and I both know we get asked a lot about that in clinic. I've been pretty lucky. I don't have to worry about that myself. I don't know if you have that condition and you could talk about it too.
And the picture that you guys are going to be seeing is a selfie.
Right. So that's called keratosis pilaris. And so that's we call it KP for short. That's an easier way to think about it. But that is, the way I think about it is just very, very dry skin. And it's basically you've got little bits of keratin or kind of dead skin cells that are just kind of stuck inside the skin, and they kind of get heaped up, so you get little bumps on the skin. I should really let you talk about it, since you know what it feels like and you know how annoying it can be.
It can be very annoying, and for those of you who do have keratosis pilaris on the backs of your arms, on your legs, you know that it can become very itchy, a little bit inflamed, and oftentimes it does make you a little bit self-conscious, especially when it comes summertime. But when we talk about skincare, we'll address some topicals that you can use to help your skin improve from that standpoint. So you had alluded to the eczema breaking down skin barriers and increasing the risk of infection. So what types of infections do we worry about in patients who have eczema?
Well, so like I had mentioned, the skin protects us from a lot of different kinds of infections, like bacteria, like viruses. The most common thing that we see with eczema is a bacterial superinfection. So I think we've all heard about staph and MRSA and that type of stuff. But with eczema, what we most commonly see is that the bacteria that normally grows on your skin just kind of goes out of control because it's got a foothold on skin that's not completely normal, on skin that can harbor a bacteria. So for that reason, especially when your eczema starts to get a little bit wetter and a little bit more yellow, that's when we really think about bacteria kind of growing on the skin. Something that we can also see is viruses that can grow in the skin too. It's another complicated word. It's eczema herpeticum, and so basically that means you have a herpes virus that's in the skin. That's pretty rare though. But if there's any time, I think the one thing that Shin and I would want you to take home from this is that if there's any time that you're worried about something on the skin, you should just see a doctor about it. But really the big stuff is the bacterial superinfection and then viruses too.
And something to keep in mind is that with a bacteria, we all harbor Staph aureus in our nose. And so it's something that's part of our normal skin flora. But when your skin isn't at its peak, isn't intact, it does raise your risk of developing infections, and this can spread. So again, the point is we'll talk about different moisturizers and what you can do to protect your skin and hopefully regain that skin barrier function that the skin serves. All right, so next question. We've talked about eczema and what it looks like, what it feels like. now we got to get down to business here. So we've got a bunch of topicals, and one thing that I want to mention to you guys is that this is just a sampling. If you go, I was at Shaw's this morning, and there are so many skincare products, and really we're going to give you guys some tips on types of products to look for, but it's totally up to you. Go experiment, see what works for you, and go from there. So especially in the wintertime, we hear about moisturize, moisturize, moisturize. Well, for me, I moisturize, 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 yet I still find that my skin's still pretty dry, and my patients come in with similar concerns and questions. So even before we moisturize, there are things that we can do to help maintain our skin health. So what are your suggestions?
Well, so I think there's a lot of things that we have to be careful about in terms of what we do on a day-to-day basis. And we talked a little bit about showering. So I think the biggest thing is that it's so easy to, especially in the dry, cold winter, it's so easy to get underneath that shower, crank up the heat, and just let it kind of just hit you on the back for a good 15 minutes, because that's not only relaxing, but it just,
I'm guilty of that.
Right, exactly. And I think a lot of us are. But I think that we have to be careful about that, because that really dries out our skin from all that heat and all that hot water. So I think that the first thing that we need to really try to do is to take shorter showers, and also to try to take them with not such a high temperature of a water. So what we always say is to use lukewarm water and to take a max a 10-minute shower. That's a little hard to do in the wintertime, but that would certainly do a lot for your skin.
And a trick that I learned from one of my attendings that I've been trying to do myself is, before you go into the shower, ramp up the water temperature and let the room get really steamy and warm. And then right before you're about to hop in, turn down that temperature dial so that the water that's actually touching your skin is lukewarm, but the air around you is moist and warm, so it doesn't feel so cold to you. So give that a try and see if that works for you. All right, so I'm in the shower, I'm in a lukewarm shower, I'm letting the water drip on me. I'm gonna reach for a soap. What sorts of soaps should I be reaching for?
Well, so I think the one that you are showing off right now, which is perfect, is Dove. And the reason why Dove is great is it's probably the gentlest soap that there is that's easily accessible in the supermarkets. And so that stuff is a great, that type of soap is a great thing to start with. And then the other thing, which I think we'll probably get to, is to make sure that it's fragrance-free.
Exactly, and this is something that is actually much harder than it seems. So we've got two different bar soaps from Dove. This one doesn't have the ingredients, but I was reading this morning that it says white, blanc. It looks like there's nothing in it, but there is actually fragrance. Whereas with this one, it says it's unscented, but you gotta read a little bit lower, and it says it's fragrance-free, and you wanna be reaching for that. So especially if you've got dry, sensitive skin, you're gonna have to turn to the back and really look to make sure that there aren't any fragrances. But I think it is possible, and Dove does make one of these. I'm sure there are other brands that do as well.
And the reason you have to be careful about that is because if it's fragrance-free, then you know that they haven't added those other chemicals in there. But if it's unscented, it's actually possible that they added more fragrance to cover up the smell of the original fragrance that was already in the soap. So it's just making the problem even worse.
Exactly. So okay, so I'm lathered up. I'm lathering up. Are there particular areas that I should avoid applying soap to? Is it going to dry me out more?
Yeah, so soap will dry you out more. So for that reason, it sounds a little counterintuitive. You're in the shower to get clean, but at the same time, sometimes it's just better for your skin if you just use the soap on areas that are actually getting a lot dirtier. So really, skin creases, so like the armpits, like that, those types of places.